All right, we're going to go ahead and get started now. I'm very excited to be here with these two gentlemen. My name is Ryan Hines. I'm the communications manager at Biomin. And here, this is part 10 of our antibiotic reduction expert series. Let me first introduce our two experts from Biomin, Konstantinos Sarantis. Good morning to you. Hi, Kostas.
Good morning. Good morning, Ryan. Hi.
Thank you for joining us. Could you, for those of you who don't know you yet, our live audience, could you introduce yourself real briefly, explain what you do at Biomin?
Yes, of course. So my name is Kostas Sarandis. I am product manager for mycotoxin risk in Biomin. And one of the tasks that I have is to work together with my colleagues and our clients in topics of mycotoxins, product solutions, and services.
Excellent. Thank you for that. We're also joined today by Diego Paduan. And Diego, hi there.
Good morning, everybody.
It's great to see you. Good afternoon for some.
Sorry, I'm Diego Paduan, veterinarian, 13 years in Biomin. My job is technical sales manager, Europe and Africa, and traveling down, supporting sales and troubleshooting problem of the customers. That is my passion. But now it's inhibited by the virus, but I will travel again one day.
Excellent, and I know that technical support that you've been providing as both a vet and someone with so many years experience, always appreciated by customers, and something that Kostas has done as well. Great, so this is, as I mentioned, the 10th edition of our antibiotic reduction expert series. It's the first one dedicated to mycotoxins, surprisingly, because Biomin is known as a world leader in mycotoxin risk management. So this one is particularly exciting, two in-house experts. And just one note for our live audience before we get started, this is also an interactive session. So that means that using the chat function that you've got in front of you in this platform, you can go ahead and submit your questions either now or later on as we progress during the session. Questions that you have about fumonisin or mycotoxins or anything related to raising pigs. We'll try to get to as many of those as we can later on. And it also means that we have a chance to conduct a couple of audience polls, which we're going to do a little bit later during the remarks to get a view of how you see some of these issues, and we'll be able to share that and use that as a discussion point later on. So that is our housekeeping. That part is out of the way, and as we've said, our topic today is mycotoxins, not just any mycotoxins, one in particular, how fumonisins jeopardize pig gut health and how to solve it. So Kostas, if you would start us off, give us a little bit of background. There are lots of mycotoxins, so why this one? Why is it important for pigs? Please go ahead and take it away.
Thank you, Ryan. So, for my part, we will see a few things about fumonisin's occurrence, fumonisin's mode of action, and the solution that we currently have in Biomin to tackle the fumonisin problems. So, fumonisins, okay, it's working. So, the first ever case documented for fumonisin's toxicity, it's in 1970 in South Africa, in where they had cases of equine leukoencephalomalacia because of consumption of moldy corn. Later in 1989, there was an outbreak in US because the corn was high contaminated with fumonisins, and they had a lot of cases with porcine pulmonary edema, which is one of the main, let's say, clinical signs that fumonisins have in pigs. Fumonisins are produced by Fusarium species. The main species that they are producing the fumonisins is Fusarium proliferatum and Fusarium verticilloides, but not only from this species. They consider as field mycotoxins, so they are produced in field. Today, they are considered as worldwide contaminants, and their occurrence, it's not only in corn and byproducts, but in other grains as well. I have a few slides regards the trends of fumonigens in corn. The data are coming from our biomini survey. So in this graph, you can see a yearly trend of fumonigens in corn for Africa. So from 2010 up to 2020, you can see the prevalence and the mean of the positive samples. So the yellow bars represent the prevalence that you can see it's quite high, and the gray line represents the average of the average of the positive samples in ppbs, parts per million. Have the same graphs here for North America here on the left and South America on the right. So you can see in both cases we have a high occurrence of fumonigens in corn. In South America, a bit more. And concluding all the parts of the world, here is the graphs for Asia on the left and Europe on the right. So you can see again a high prevalence of fumonigen in Asia, something similar with what we see for South America, and lower but still high prevalence of fumonigens in Europe, similar trend with North America.
Excellent. So we definitely see that fumonigens are problems in terms of occurrence. They're widespread, they're global, as you mentioned, and they're occurring in the field. Let's go to our audience for their first poll question and ask them at this stage, how serious do you consider this risk? So for those of you listening live, please go ahead and select the one best answer that fits your views. How serious do you consider the risk posed by fumonigens to swine operations? As Kostas has showed us, this is something that was identified first in a select number of countries, but is now seen as a global problem. So do you see this as high risk in your operations or in the operations you consult for? Do you see it as moderate risk, low risk, not a risk, or you're not sure? And please go ahead now, take another second or two to choose your one best answer. Only one answer is allowed. We already have half of our live audience voted. It's a great turnout. The answers are coming in very considerably towards the top couple of answers, not to influence you, but now with two-thirds of our listeners, voting, we're going to go ahead and close the voting for now. Thank you for everyone who participated. Great to see that input. Kostas, I'm going to put this right back up with the results from everyone who's listening right now. We had pretty clear trend here that everyone listening considers fumonigens as either high risk or moderate risk for the most part. How well did we do as a group? Did we assess the risk correctly? What's your professional view on this?
Yeah, I mean, I think that's the case. From the graphs, although it's graphs from let's say per region and it is only in corn, you can see a constant presence of fumonigen and let's say a fluctuating risk in terms of concentrations. So you have a presence always and a fluctuating risk, but you have always a risk. So I think thinking of course the negative effects that fumonigens can have, although absorbed in a very low percent, as you will see later on by Diego, the risk of fumonigens in a swine operation should be always a consideration, and the management of fumonigens should be part of the quality control in a swine operation for sure.
Great advice. And so what can you tell us then about what fumonigens really do once they get into a pig's body?
I can share a slide that I have by accident here, and it's the fumonigens mode of action. So what the fumonigens do, they are blocking the biosynthesis of ceramide. So they are blocking the acetylation of sphingolin and the reacetylation of sphingosine that is coming from the turnover from complex sphingolipids. And as a result, we have accumulation of sphingolin and accumulation, but in a less extent, of sphingosine. So in this case, the ratio of sphingolin to sphingosine, or the SASO ratio, it increases after fumonisin contamination. And as we will see later on, the ratio of sphingolin to sphingosine, it's a very well used biomarker in scientific experiments to assess the toxicity of fumonisins. To answer to your question, Ryan, the ceramide is a structural component of the cell membrane, and it is also responsible for the cell membrane functionality. It's responsible for the differentiation and the apoptosis of the cells. That's why fumonisins are also considering carcinogenic. And also the sphingolipids have a part, they are playing a role of messengers in the body. So in this context, when you have a blockage of the sphingolipids metabolism, you can have different negative effects. For example, in the immune system response, and fumonisins also targeting the liver and the kidneys. Hope it was a good answer for you, Ryan.
Absolutely. A very technical, very educated answer, so I appreciate that. So here I think we start to see maybe the tie-in to why this is a topic when it comes to antibiotic reduction in the field. Isn't that right?
Yes, that's true. And this is the case not only for fumonisins, but for all mycotoxins. The mycotoxins can interfere with the immune system, and there is numerous publications that the fumonisins have been shown to act as predisposing factors. So the mycotoxins and fumonisins, let's take the example of fumonisins. Fumonisins can result in vaccination failure. There are publications of this, and also fumonisins can, let's say, allow the pathogens that they are already in a farm to act in a more severe way. So they can facilitate the pressure and the infection of pathogens that they are present in the farm. I think Diego has a few examples later on.
Great, and we'll look forward to those in particular. So is it fair to say then that particularly if you're looking at reducing the antibiotics in your system, or removing them completely from your feeding program, that mycotoxins actually are more important, and that you should pay more attention to them?
I think so, yes, definitely. Thinking the broad spectrum of negative effects that they have, a part of the cell toxicity, let's say, and considering that when we are discussing about antibiotic reduction, one of the main, let's say, pillars that we have is the proper use of vaccination programs. So anything that can compromise vaccination efficacy in a farm can create a problem in our antibiotic reduction program that we try to apply.
Sure, and you've just mentioned that fumonisins are a concern there when it comes to vaccination efficacy. So there's definitely several reasons.
Moreover, sorry that I interrupted. Moreover, for example, for fumonisins, we have seen that they can interfere with, they can result in they can compromise, let's say, the vaccination of mycoplasma. And we do know that respiratory issues in a swine farm is very important because the swine are, let's say, sensitive in specific respiratory diseases, and the presence of the respiratory diseases in a farm can compromise the growth of the pigs, so our profit in a farm.
Absolutely. So that's a major concern. It sounds like another reason to take this into account. Now, Kostas, you mentioned other mycotoxins, not just fumonisin, and with that, I think there's probably a conventional way that most people mitigate mycotoxins on their farm using adsorbents, right? Binders. Can we turn into discussions about strategy and mitigation strategies for this? Would that be all right with you? If we start with another audience?
Yeah, of course.
Okay.
That's cool.
Let's do it. We're going to turn to our audience once more. Let's get your views on this. So please, for all of you listening, let's see what you think about conventional mycotoxin binders, which are more, let's say, technically known as adsorbents. Are they effective against fumonisins in particular? Now, we're not talking about all mycotoxins. Are binders, do they work well against fumonisins? Please select what you think is the best answer here. Yes, very effective, somewhat effective, not effective, or perhaps you're not sure. So we're going to give everyone a few seconds to weigh in here. And just as before, we're going to go back. Everyone was much quicker this time to answer. So we have 2/3 of our audience have already weighed in here. I want to thank you all for those of you who have participated. Kostas, once again, we're going to go right back with the results. So let me put those up for everyone to see. So the results of our live audience, only 4% said that binders were going to be very effective against fumonisins. 42% said somewhat effective. 41%, so very close between somewhat and not effective against fumonisins, and 13% were not sure. Kostas, could you give us your expert view here?
So the majority of our audience believes that the binder is not an effective solution, correct? Because I cannot see the poll, that's why I'm double asking, sorry.
Correct.
Okay, good.
Not effective and somewhat effective.
I'm very happy with the answer. I mean, one of the issues usually that I have seen traveling around the world is that the awareness of mycotoxins and of mycotoxin risk management strategies varies from not from country to country, even within a country from client to client. And thinking that the mycotoxin decontamination history is not that long, it's a few decades, everybody thinks that everything is a binder. And this is not the case, of course. And I mean, sometimes I'm frustrated when they say they describe Mycofix as a binder. So thankfully, the scientific community have give us an answer on this. So we do know that the binding strategy, if you like, can be an effective strategy for some mycotoxins, especially for aflatoxins. But we also do know today that not all the mycotoxins can be bound. So we need other strategies, biotransformation strategies. In the case of fumonisins, thinking that the fumonisins are absorbed very quick, and although in a small percent or in a small rate, and although this small rate can create the problems, this is the fumonisin paradox anyway. So we need a solution that it is fast and complete to put out of picture the fumonisin or the mycotoxin risk. And we are proud in Biomin that we have different enzymatic biotransformation strategies for different mycotoxins. And for fumonisins, we are proud to have the first and only purified enzyme that detoxify fumonisins.
That's great. Can you tell us more about this? And we also have a question in from Abdul. Is this biotransformation using enzymes that you mentioned, is this the best way to deactivate mycotoxins?
Yes, it is. Currently, we don't know what the future holds with the technology progress, but we, at the moment, the best, let's say, strategy or the best approach is the enzymatic deactivation. And this is the route that Biomin has taken, starting, and the Biomin R&D, just for your information, has invest on transformation strategies, resources, start in 80s. So the first ever project in Biomin R&D for biotransformation, it was in 1980. So we have invested so far 30 years in biotransformation strategies for mycotoxins, and we have come up today with the first purified enzyme for the detoxification of fumonins, and hopefully soon enough we'll have more enzymes available in the market for other mycotoxins.
That's great. So you mentioned this was state of the art.
Yes, at the moment it's the state of.
And you've also said that the solution needs to be fast, it needs to be complete. And you've cited the case of Fumzyme here from Biomin. Can you show us exactly how this type of solution performs in the field?
Of course. Let's see the example with the fumonisin B1, which is the most toxic of the fumonisin groups. So the Fumzyme, what it does, it biotransform or hydrolyze the fumonisin. So the Fumzyme breaks or cleaves these two tricarboxylic acid chains and transforms the original fumonisin molecule in a hydrolyzed fumonisin molecule. The full reaction is fast as an enzymatic reaction. The product of the reaction, the hydrolyzed form of fumonisin, it is non-toxic, and the full process, it is irreversible, something very important. And this is a clear, let's say, benefit or advantage with the enzymatic solution, the non-irreversibility. One of the advantages, if you like. So if I can carry on, Ryan.
Please go ahead.
A few slides more for my part regards the Fumzyme efficacy in pigs. So I would like to start with an ex vivo experiment that we have, which is part of one publication from our R&D group. So in this case, we took intestines from fattening pigs. We did sections of the intestines, and we spiked these sections with fumonisins. Specific here in the picture, you can see the sections from the results from the sections of in duodenum and jejunum. So you can see the solid line is the concentration of fumonisin, and the dotted line is the concentration of hydrolyzed fumonisins. So all these were spiked with fumonisins, and this is the control without Fumzyme inoculation, and here is with Fumzyme inoculation. What you can see is that the fumonisin concentration in both segments stays constant, and we don't have any hydrolyzed form of fumonisins in both cases here. If we go to the right part, you can see a decrease of the fumonisin concentration in both cases, with a subsequent, of course, increase of the hydrolyzed form of fumonisin concentration, which depicts the biotransformation of fumonisins to the hydrolyzed form of fumonisin by Fumzyme. And I want to continue with an in vivo in this case from the same publication, which is open. It's open access, so everybody has access in this publication. So we had 4 group of piglets: control group, the gray, fumonisin group, the red, fumonisin group with Fumezyme, the blue, and fumonisin Fumezyme group as a positive control group with the green. The duration of the trial was 42 days, and we took serum samples and we measured the saturation that we just talked before in specific time points. The contamination of fumonisin, in this case, it was 2 ppm, parts per million. So you can see at day 28 and day 42 an elevation of the saturation because of fumonisin's toxicity, and a non-elevation when we used the Fumezyme, as the saturation is as in the control group, because the Fumezyme managed to break the fumonisins, to deactivate the fumonisins, and we didn't have the blockage in the sphingolipids metabolism because of the fumonisins. And I want to show a last one, again in vivo trial with piglets. In this case, we have again post-weaning piglets, 2 ppm of fumonisins. The duration was 42 days. So we had 3 groups: control, fumonisin group with 2 ppm of fumonisins, and fumonisins and Fumezyme group with 2 ppm fumonisins and 15 units per kilo feet of the enzyme. And this is the SASO ratio at the end of the trial at day 42. You can clearly see the elevation of the SASO ratio because of the fumonisins, and the non-elevation of the SASO ratio because of the Fumezyme. And a couple of slides more regards performance from the specific trial. So you can see that fumonisins decrease the final body weight compared to the control, or the daily weight gain if you prefer, compared to the control. And you can see the protective effect of Fumezyme that did not allow this decrease in growth because of fumonisins. And the results on the daily feed intake, in which in this case we don't see a negative effect of fumonisins in feed intake, but because of the growth we can see a negative effect on fumonisins on the FCR, and a protective effect of the Fumezyme that keeps the level of the FCR close to the control group. And with this slide, I finishing my part, Ryan. Just one more thing. I was checking yesterday because usually when we run a trial, we also do some economic calculations. Unfortunately, the pig prices currently are not good, let's say, at least. But I mean, assuming that a live weight price of the piglets at the entrance of the trial, 4 euros per kilo, and a live weight price of the piglet at the exit of the trial, 2 euros per kilo, which is unfortunately not the case now. The inclusion of the Fumezyme to tackle the fumonisin effect on the performance, it was 2.5 euros per pig. It's quite substantial amount. Thank you, Ryan.
Yeah, Kostas, thank you for that. Scientific literature, the trial results, great to see that. And of course, the Fumezyme component is part of the Microfix portfolio of solutions offered by Biomin. We will come back to you again, Kostas, later on as we continue to have questions coming in. So I'm sure we will speak to you again later. But for now, let's turn to Diego. Hello again, Diego. We are going to make one technical switch here. You're going to see the opportunity for you to put your slides up. for our audience as we delve into the practical aspects of that. So we build on what Kostas has said as our foundation of the theory and history and the technical details to get closer to the field. And also, of course, delving into your knowledge as a veterinarian as well.
Okay, good morning again. Can you see my slider?
We do. Please go ahead.
Perfect. So I just start from the most important part of the mycotoxin physiology in the body is absorption. Because many people are skeptical about adopting counteraction with fumonisin because it's very well known that fumonisins are very poorly absorbed, from 3 to 6%. And so they say, why do I have? It's going through and out of the animal. But this is true if you only poison an animal with only fumonisins. But it's not the case because more than 90% of the times, fumonisins run in many of them. Usually fumonisin, DON, zearalenone, and others are together. We see from the sample that 3, 4, 5, and more mycotoxins are present in the same sample. The second point is the after absorption. There is an enterohepatic circulation. The mycotoxin is absorbed, goes into the liver through the blood, is conjugated to bile salts, excreted in the intestine, separated again, reabsorbed, and there is a recirculation. In case of fumonisins, from 1 hour of half-life in swine, from 1 hour and 1.6 hour in half-life in swine, if you block the enterohepatic circulation, you nearly half the duration of the half-life in the blood. But get back to the conception of, let's get back to the conception of absorption. So 3 to 6% is true in very few cases. What are doing fumonisin? And I will come on that later. Fumonisin are mainly affecting the gastrointestinal tract, and then when they are absorbed, also the immunity and the physiology of phospholipids. But what I was saying, what is very important is the synergism with, you see, fumonisin B1 is a synergetic with trichoticin, is synergetic with ochratoxins, is synergetic with aflatoxin. And so in this case, all what is seen in simple intoxication of fumonisin is not true anymore. And we can see, for example, from the intestine that fumonisin is having a negative effect on cell proliferation of the gastrointestinal tract, synergetic with trichoticin, deoxynivalenol and T2. Is active on destroying the tight junction and increasing the permeability of the gut, and you have a leaky gut, and the synergetic with DON. Is active on altering cytokine production. Cytokines, you know, is the opposite of hormones. Cytokines is the alarm signal of the cell to the body. I have an attack, I have an injury, I have an intoxication, and the body is reaction. Well, this cytokine production is jeopardized by fumonisin, but also by trichoticins and zearalenone. So in this case, you see mainly on permeability. When fumonisin is present with DON, that almost always is the case, the data of 3-6% is not more valid anymore. And we see in the case of fumonisin, for example, the huge statin wild of E. coli in the in the intestine, and this is almost sure diarrhea at weaning, where already you have weaning stress, changing of diet, and altering of the gut mucosa for technical reason or environmental or management reason. In presence of pneumonicis, you have almost sure E. coli diarrhea. Another important case comes from Pastorella multoxida. Pastorella is one of the most classical condition disease. If there are not the condition, Pastorella is present in the lungs, but not causing any problem. So in this trial, it was first tried to inject in the trachea of the pig a dose of Pastorella multoxida, and after a while there was developing of cough and nothing more. Some cough to cleave the bronchi and not much. In another trial, only fumonisin was administered for 1 week, and also here, because of edema of the lungs, there was developing of some cough and nothing else. But in a pig already intoxicated with the fumonisins, we inject Pastorella multoxida. After 2-3 days of cough, we have development of full pneumonia, because mycotoxins are recognized as primary opening door for many pathogens. And since most of the pathologies are conditioned disease, conditioned by stressors, conditions, clearly mycotoxins are in this situation. Another huge, very, very nice experiment done by Grenier is about exactly a trial done on immunity, and we have 4 groups. It's control without any mycotoxin, a group with deoxynivalenol, a group with fumonisin, and the last group with fumonisin and deoxynivalenol together. First of all, we see that there is an interaction and adding activity, worsening activity of the 2 on hepatic lesions. But what is more important is that after 1 and 2nd injection of an antigen, ovoalbumin is done, because for sure in whatever pig there are no antibodies against ovoalbumin, so it's not interfering with any disease, because ovoalbumin is a protein, so it's creating an immune reaction. You see that in the control group you have a type of reaction that is decreased already by DON alone, is decreased by fumonisin alone, but together fumonisin and DON have adding, if not synergetic effect. And this is on specific humoral answer. The same happens with cytokines involved, because the cytokines, as was saying, is the alarm signal of the cells to the body to attract protection. Dendritic cell, macrophages, immunity antibodies. You see that the 2 kinds of interleukins or cytokines are decreased both by DON, fumonisin, and together. To go to the full picture, it was seen that the 4 main steps of immune reaction are jeopardized by the two mycotoxins together. So the cytokines involved in recruiting antigen-presenting cells, because the macrophages, dendritic cell, you see macrophages, dendritic, are attacking the antigen entering in the body, are taking this, extracting the antigen part and presenting to other cells presenting the antigen. This is jeopardized by the 2 mycotoxins. The same is cytokines involved in activating specific immunity reaction. The same happens in the ability of lymphocytes in the lymph nodes to proliferate and start to produce antibodies, and last but not least, ending in lower antibody production. Well, all the four steps you see in the light green bars, all the four steps was shown that Mycofix with its enzyme destroying both trichoticins and fumonisin were able to completely counteract the negative effect on the immunity. It's not depression, is destruction, because are completely destroy some pathways of immune reaction, and this is absolutely dangerous. Another point is to remember, then I go on practical points, that also fumonisin can enter in the infertility issues, because lesions to the uterus or gestating sows, or improving or facilitating lung or liver pathogens, we have also a decreased viability and embryo and neonates with abortion and stillbirth. Let's go to practical tips. This comes from an experience we did this year after the pamphlet that was published by the biggest livestock and pig meat producer in the Netherlands. We took the chance to create a series of slides showing exactly what a vet can see in the field or at slaughterhouse. So there might be some signs, some lesions that may give the suspicion that behind there can be also mycotoxin, in this case fumonisins. What is important after seeing signs and eventually lesion in a slaughterhouse or necropsy is differential diagnosis, because too many times we see that the application of remedies like Mycofix is not successful because the diagnosis was not precise. So on differential diagnosis, we really focus a lot, because that is the key and the way to success. So one of the signs one can see from fumonisin, that are the mycotoxin intoxication in the liver, is the yellow liver, that is degeneration of the fatty liver syndrome. This is just a little, but is already pathologic. Or at the earlier level, you see white spots that already is showing a suffering from the liver. On the long run, you go into cirrhosis. But you know, cirrhosis is hard to see in the pigs because already the pigs have a liver that looks like cirrhotic, but is not. So one need to feel the consistency and really to be. This is a cirrhotic. On the right hand, you see a normal liver. So the liver can be a signal or a help to have the suspicion that there was, but it's already too late, because the damage, the lesion are already happened, and it's too late. And we are already maybe at the slaughterhouse. For the next time is bad, but important to understand that there was an intoxication to react on the other pigs. Differential diagnosis, nutrition excess, intoxication, Leptospira, Salmonella, vitamin E and selenium deficiency, and these are done by the vets. The next organ that we see that is happening, and this is unique for fumonisin, is the porcine pulmonary edema, that doesn't need to be that big to give signs. You have anyway dyspnea and poor performance. The lesions are interstitial pneumonia and edema. Differential diagnosis is not that simple. microscopically you see the edema, and is not, remember, is not direct intoxication on the lungs, is from the jeopardizing of the ceramide physiology, as was describing Kostas, that you have a slower neuronal or nervous transmission, and you have an imbalance of the in the heartbeat, and with the deficiency of the left side. So there is an over high pressure in the little circle that is in the lungs, and so you have edema because the heart is unbalanced. In the worst case, you see something like that, and this is quite clear. Differential diagnosis, clearly, nowadays they always think about PERS, flu, and whatever. It's not easy to, because PERS is present, circovirus is present, so it's absolutely not easy. But also here, fumonisin is acting synergetically also with infection or diseases. And so it's more easy to find lungs like this. As last picture, I show you that another pathology that may happen is far from the classical, that is about fertility, because fumonisin with others can cause abortion and stillbirth. So the lesion of aborted piglets, differential diagnosis is not that easy. But I repeat, remember that the so-called fumonisin paradox, people think is not dangerous because the absorption looks like to be very low. It's not true. It's higher because it's favored by other intoxication, and fumonisin are acting synergetically with other mycotoxins. So fumonisin risk is medium-high risk in livestock. And with this, I thank you very much. I'm now ready for your questions.
Absolutely. All right. Thank you, Diego, for those remarks. And we're also going to bring Kostas back, who's been listening intently. You can leave the slide up, or let's see what we have next.
Diego, I think you need to use your last slide, maybe.
Yeah, if you would just leave that up. And as we get started.
Everybody, this is the new member of Diego's family, her granddaughter. We can see your desktop, Diego.
Congratulations. Not related to fumonisins, luckily, but
thankfully did not take from her grandfather. Thankfully.
Good.
Anyway,
let's get started with something that you began with at the top of this session, Kostas. You've sparked some interest in the Biomin mycotoxin survey. Now, this is the longest running, largest survey of its kind and mycotoxin occurrence. But we have people who are listening today who want to know more information about it or have questions about their specific countries where they're operating. Where can they get more information about these results?
The simplest and easier way is to contact their local Biomin rep. I mean, with the Biomin surveys, it runs since 2004. We have a lot of, let's say, we are doing like close to 100,000. I'm not sure about the numbers, but I think we do something like close to 100,000 analyses per year from 80, 90 countries. It is a service that we are using, and we are provide to our clients. From time to time, we do different, let's say, publications and communications and dissemination of these results. But for more, let's say, specific data, they should contact the local Biomin reps.
Great advice. And related to that, you had indicated that the concentration of fumonisin, the occurrence tends to be going up globally, but the concentration fluctuates. How should people be monitoring that? What advice do you have in terms of identifying that in their feed materials?
Okay, that's good one. The thing that we used to do is feed analysis, raw material analysis, establish a specific quality control, and apply it. So based on the results, you can have an idea about the risk more or less. And there are different, let's say, analytic methods available. If you want to give it, the more quick, the less quantitative the analysis, the less time, the more quantitative the analysis. It depends. I mean, you can have strip tests, you can have HPLC, you can have ELISAs, you can have LCM, SMS, one that we currently have. This is the one thing that you can do. And another thing that it's coming in the picture, and we are very proud again that we are once that they introduced the concept early enough. It is the prediction of mycotoxin production during in harvest in the field. So we recently, last June, we launched our Biomin prediction tool, and there is on our website updates about the risk, the predicted risk for Europe. Our Biomin prediction tool gives predictions for corn for 4 mycotoxins: fumonisin, aflatoxin, deoxynivalenol, and zearalenone, and for wheat gives predictions for deoxynivalenol and zearalenone. And again, as I said just before, for more information, whoever would like to have a bit more of information, he should contact the local Biomin rep.
Great.
As a teaser, or just to have an idea, everybody can access our website and see the latest update. This week, another one is coming.
That's a very good point. Everyone should stay tuned for that. Later this week, we'll be publishing the results for Europe, I believe. So if you're great. So we've had questions about guidance levels, maximum levels, regulatory levels for fumonisins. To what extent can you speak to those? What's a high level, or what numbers are too high in your opinion?
Difficult answer. There is not one number. And why it is difficult? First, you don't have a single mycotoxin in your feed, like never. You have a co-contamination of different mycotoxins. Second, the effect of the mycotoxins, it is also farm-related, let's say. Feeding same levels in 2 different farms with different challenges, you might have a different effect. And even in the same farm, you can have different effect from animal to animal. In some cases, it is also sex-related. So you cannot give a specific value. There is, of course, first of all, the fumonisin specific are not regulated, but there are recommended levels for the feedstock from European Union and the FDA. The FDA, if I'm not mistaken, it's like for pigs is 20 ppm in corn, but use the corn up to 50%. It's that specific, the FDA. The European Union recommendation is more simple. It's 5 ppm for feedstuffs dedicated for pigs. This 5 ppm from the European Union recommendation is derived based on the pulmonary edema clinical signs. So the 5 ppm is correlated with the pulmonary edema. But we see that it's not just the pulmonary edema clinical sign, but there are also other negative effects that you have. So for sure, the 5 ppm, in my opinion, it's not the threshold.
Okay, so caution at a lower level would be relevant. Yeah, Diego, did you want to add to that?
Just by a veterinary point of view, talking about a maximum level is just an exercise. What is happening really in the industry that you don't have clear signs, because everybody is trying to avoid clear signs of mycotoxins. The pulmonary edema is very difficult to find or to see or to recognize as coming from fumonisin. What is happening today that all the system is putting below recommended levels all mycotoxins, and so you don't have clear signs. You have subclinical intoxication. That is anyway permeabilizing the intestine, is anyway compromising a bit the lungs, is anyway immune suppressive. And so you have problem with from other pathogens together with management mistakes, and you are not able to solve the problem. So the point is subclinical intoxication that is always happening. Maybe in one case you don't, but you always find some mycotoxins. So a wise farmer take counteractions. Okay, this is my point of view of a vet, because myself many times it's very hard to find out the real cause of some pathologies that you don't know how they are set wild.
Yeah, that's a great insight, and it points us in the direction of mitigating fumonisins, counteracting these other mycotoxins as well, and of course. MycoFix is that leading, most innovative product on the market to do so. We've got a number of questions about MycoFix and Fumzyme in particular. So, Kostas, I think I'll direct these to you, but Diego, please feel free to add if you can in the time remaining. Thank everyone for the questions that are coming in. If we don't get to your question now, we will come back to you with an answer later on in written form. So, first of all, let's start with the basics. Fumzyme, you said this was irreversible. Can you explain how perhaps this biotransformation is different from what a binder would do?
Okay. The binding, when we are using an adsorbent in general, it can change the bounding, let's say, effect when it is changing from pH to pH. Not all the binders are having the same reabsorption, if you like. It has to do with the quality of the binder, of course. It has to do with which mycotoxin you are trying to bind. But this is the irreversibility that we are talking about.
Great. So in terms of the efficacy of the product, we've got a number of questions then. So at what pH levels is it most effective? And is it effective at the, of course, level in an animal's GI tract?
Yes, it is effective in a wide range of pH from 4.5 up to 8 pH, right? And it can also survives through pH, through lower pH and stomach pH, actually.
Okay. An interesting question here is, what's the highest dose of fumonisins that Fumzyme can handle, right? So if we're talking about a very high contamination level.
I remember some numbers. For sure we have an in vitro that we decontaminate or detoxify 72 ppm of fumonisins with 17 units of the product in 20 minutes. To give another perspective, in its optimum, the enzyme is doing 200 cleavages per second.
So 200 fumarazen molecules are detoxified.
No, not molecule, the full molecule, the one branch.
Okay.
Okay, 200 per second. I think it's quite fast.
All right, and this is why you mentioned the importance of speed there earlier on. That's great. We're getting a little bit more into the application then in a commercial setting. What means do we have, or what characteristics of FUMZYME make it possible that it remains effective after you mix the feed or during feed processing? What alternatives and what results do you see there?
I think it's from me. The question is from me. I mean, all Mycofix ingredients are pelleted stable.
Great. So there you have it. So that's there's no issue then.
And the beauty of going to the purified enzymes, it is that it allows you to use also post pellet application. So you can use the unpurified enzyme in a liquid form for a post pellet spraying.
Okay, so you've got different applications for different feed formats. Great. Gentlemen, I want to thank you. Well, I want to thank our audience as well. We have come to the top of our session. We have more questions, which means there'll be more follow-up and more discussions happening offline outside of this forum. But it was a great discussion. Thank you both for the information. Thank you for all those great questions. Please stay tuned. We're going to continue the antibiotic reduction expert series here in the coming weeks and months. I believe in next week, we're looking at mycotoxins in poultry, so closely related, and we'll have further topics that we will announce upcoming. So please stay tuned, speak to your Biomin representative, check for those email invitations as they're coming through. And we look forward to speaking with you again in the near future. Just before we sign off, I wanted to ask you to do us a favor. We've already had great recommendations, great suggestions come in as we've conducted this session. Please go ahead and give us your feedback if you haven't already. Once the session closes, please take a minute or two to fill out the 10-question feedback survey that we're asking. It helps us to adjust this and make sure that it meets your needs and it's useful to you in your job. So on behalf of Biomin, I want to thank you, Diego, Costas, thank you so much.
Thank you. And thank the attendees for the time that they dedicated this morning, of course.
Absolutely. Wish you the best of luck in protecting your operations against fumarazins and other mycotoxins. On behalf of Biomin, thank you and have a great day.
Bye.
All right.